the minister's clarification, the fallout from his earlier visit lingers. His decision to dismiss the chief executive officer of the hospital, Dr. Adamatiku, has been heavily criticized, particularly by the Ghana Medical Association and some health analysts who argue that the move exacerbated tensions at an already strained facility. Now, in an effort to defuse the situation, Parliament has intervened, appealing to striking doctors to return to work. During a visit to the hospital earlier today, member of the Parliamentary Select Committee on Health, Dr. Kingsley Adjaman, criticized the health minister for what he believes was an action that undermined the morale of the staff, and he insisted that the minister issues a public apology to restore trust.
They are asking for an apology from the minister, which will serve as a deterrent, because the Tamale Teaching Hospital has had a history where healthcare givers have been attacked by the public before. So we believe, or I believe, that when the minister renders such an apology, it will prevent any further issue. Nobody's beyond an apology. Absolutely, when you have done deeper introspection and deeper reflection, and in the supreme interest of affairs, where the caregivers will have their peace of mind and feel safe in the environment that they work, and also to act as a way of preventing others from taking an action which they have taken in the past before. Because per what we have seen, the videos that we have cited, it is more or less and the kind of bereft of bashing that is happening on the social media. Most of it is exposing the health system or the health sector. So we believe that apology will calm things down. The doctors will have the confidence to do their work freely without fear. So I believe everything that they have asked for is justifiable. We are saying that you plead with them. They should let calmness prevail, and we should resume work immediately so that we can have a very safe health system delivery.
Now, let me paint a picture for you of what the hospital looked like earlier today when clients and patients arrived. There was a lot of frustration there, and many people had come there to seek medical attention. But we know that the strike by the doctors meant that the consulting rooms were empty. Listen to some of the residents who spoke to our Northern Regional correspondent.
We are never satisfied with the service of the Tamale Teaching Hospital. Patients are complaining. You will send your patient to the hospital. The necessary care to be given to the patient is not there. At times you will see that they will put a test to a patient, demanding the patient to take the test to the lab. Sometimes they demand that a patient should go and request for something either from a different unit, maybe from the lab, from PayPoint and all that. This should have been done by nurses. At least the administration should have passed this to the nurses, that you are there to assist patients, not you are there to sit down, relax and hold your phones on social media.
You may have seen on social media various concerns being raised by different people. The issue about the quality of service at the Tamale Teaching Hospital predates this recent incident which led to the minister's visit. Our man in the Northern Region, Noah Nash, has more to share with us on this. Now, Noah, tell us how long these concerns about the TTH have existed.
Problems that have existed for more than, let me say, almost close to about 6-7 years, based on the fact that you realize that most of the CEOs that were appointed were acting CEOs And so this one apparently happens to be a very good one, who actually a specialist whom a lot of people knew. So it was quite easy. But let me put you to the right spot in terms of the concerns. The concerns have been that patients who visit or clients who visit the hospital don't get customer experience service. And customer experience service is more often a bigger problem within the hospital. Now, when a customer experience problem has not been addressed, and you even report it, and you want it to be addressed, the problem also becomes that familiarization in terms of what you call heterogeneous society we find ourselves in another way also plays a key factor in resolving those problems. So it becomes a pretty difficult one for any CEO. I'll give you an example. There was a client, apparently, who visited the hospital and had a spine-related problem. So the family called me because they felt that I was a journalist, and so we were doing some investigation, so they got wind of it. So they invited me into the matter. What was it? They said they wanted to move one of their sisters who had a spine-related problem to a hospital called Ababana Hospital. In the process of transporting the person there, the hospital insisted that they must use an ambulance, which is the hospital ambulance. Then they said, how much would it cost? They gave them a cost at 150 Ghana cedis. They paid. Then, when they are about to leave, then they said, no, it must be accompanied by a nurse from the hospital. And that will also cost them 100 cedis. This is something very factual, something I have investigated myself. So the people paid 250 Ghana cedis. They never got a receipt for the service they actually got from the Tamale Teaching Hospital. When I went further to actually demand for those receipts, because the client actually wanted the receipt, they refused blatantly and told them that that is how we do it. Now, the current CEO, excuse me to say this, with all apologies, our listeners must appreciate that there are department heads in the hospital, which is the TTH. You realize that when you file a complaint to his desk, he is proactive in managing those particular challenges. He goes for, push for it, have a dialogue with you, do all those things. But in the process, the departmental heads are not cooperative. As if that he is a CEO who is helpless. Look, there are times that they issue that receipts to patients when they are even on NHIs. You will be told, and we have witnessed, and I've shared those videos with you. People have brought in evidence to us, and we have visited the hospital and shared with them. All these things are accumulated problems.
Right.
Water crisis, for instance. Let me go to the water crisis. That will interest you most. The Tamale Teaching Hospital has a water crisis. It is not a water crisis. It's an artificial problem they have created themselves. There are 2 water tankers in the Tamale Teaching Hospital. They are assigned a coupon by Ghana Water Company, and they pay for those services. Guess what? Anytime the water company, the TTH van, or which is the water tanker, reaches the point where he has to take the water, that vehicle doesn't join the queue. I witnessed it, I film it myself. And when it doesn't join the queue, it picks up the water. Where does it take the water to? If it is supposed.
Well, too bad we've lost no other. We'll try and rectify the connection and bring Noah back. But thankfully, we've been joined by spokesperson for the Ministry of Health, Mr. Tony Goodman. I'm grateful for your time this evening. So that's my colleague in the Northern region painting a picture to us about concerns clients of the Tamale Teaching Hospital have about services rendered there. Before we get into the matters involving the services at the Tamale Teaching Hospital over the years, I'd like for you to share with us the official reason for the dismissal of the CEO.
Thank you very much, my sister. The official reason is just simple. During the Easter holidays, we had a lot of stories in the social media suggesting that there is this malpractice at the hospital that led to the death of a patient. So early morning on Tuesday, the minister quickly jet off to the hospital to go look at what was happening. He didn't go with the media. I'm sure the media get wind of it and then met him there. So when he got there, he decided to, as usual, visit some of the places that your colleague just talked about, where at least a patient will get that customer experience, washrooms, the various laboratory theaters, where imaging theaters and all that. When the minister got to all these areas, it came out clearly that MRI wasn't working in the facility, CT scan wasn't working, X-rays are not working, and other critical life-saving equipment were not working in the hospital. So he moved back to emergency area where the purported malpractice actually happened, and then started questioning the head of department there with other staff. And then the head of department, during the discussion, mentioned that why are we making a lot of fuss out of this whole just one death? We are blowing this whole thing out of proportion. So the minister wasn't happy and said that one death is enough to at least warrant this reaction. So it became back and forth. The guy also, the doctor also repeated the same message and said there were things they needed. And then the minister said, no, you had what you are supposed to get to save this life. But unfortunately, you didn't actually communicate well, and then we lost this life. So based on all of these things, the minister realized that what was missing is that leader, that manager that will hold the facility together.
Sorry to interject, Mr. Goodman. So we know that there are laid down processes that have been established in looking into cases of medical negligence. Have those processes been executed? And from your responses to me, it appears that the minister had a preconceived judgment or had made up his mind that indeed the doctors were guilty in this matter without giving us evidence of any process being followed.
Except what I am saying is different from what you are listening to, because I have just given you a rundown of how the minister got there.
I understand. I appreciate that, but that is not the process. But Mr. Goodman, that is not the process in establishing a case of medical negligence, is it? It's a visit by the minister. I just want us to be clear. A visit by the.
When the minister got there,
right,
he visited other places and realized that these facilities were not working. This is just to buttress some information the minister got earlier before going there. The community was ready to attack the hospital. So the minister actually used this period just to forestall some of those things that were going to happen.
Okay, so if I get you right,
when we went around, lift wasn't working.
Okay.
Equipment, the washroom was not available for patients to use. A lot of things were not right.
But Tony, you would agree with me that this is not an exclusive problem to the Tamale Teaching Hospital. In fact, before he became minister, at the time when he was with the minority, Mr. Akando visited the Kolebu Teaching Hospital and a lift was not working. It became a matter of public discourse. In many of our premium hospitals, we have MRI machines that break down occasionally. Clients and patients complain about this. I am simply asking that, is that the sole reason why a teaching hospital CEO was dismissed? Could the minister have waited for a conclusion of a process involved in determining whether there was indeed a case of medical negligence, or it is just because these things you talk about are not in place, that's why he's been dismissed?
So the CEO wasn't dismissed because of medical negligence.
Okay.
He was dismissed because of the way the facility has been run down. A 3-member committee has been formed to look into the negligence aspect of this whole issue.
Okay.
He went there because of the reprisal attack we were told about, to just go and get calm to prevail, and then decide to tour this facility and realize that a teaching hospital has no basic life-saving equipment. And then he asked, have you reported this to me? He said, no. Have you told any of my officers? No. Who, again, is supposed to take this information to the appropriate quarters for redress?
Mr. Goodman,
it is the
I'll have you hold on. I'll have you hold on. Just give me about 3 minutes, because his colleague MPs have been reacting to this decision to dismiss the Tamale Teaching Hospital. I'll come back to you to wrap up the conversation.
Now, the Member of Parliament for Tamale North, Alassane Soyini, has clarified the circumstances surrounding the reported altercation between the Minister of Health and a medical officer at the Tamale Teaching Hospital. According to him, the confrontation rose from the minister's question to the medical officer, who allegedly remarked that the recent death of a patient at the facility had been blown out of proportion.
In the course of his narration, he made, he used a certain phrase, let me put it that way. He said, and I quote, "I do not even understand why this matter, referring to the death of the gentleman, is blown out of proportion." He did not understand why it was blown out of proportion. That's when I stepped in as a representative of the people to caution him that, dog, you have done so well so far, but please do not, make that statement again. One life is enough to be blown, one life lost is enough to be blown out of proportion so that other lives will be saved. So don't make that statement again that you do not understand why this is blown out of proportion. That was a caution to him. Unfortunately, he stuck to his position that it was simply blown out of proportion. It can affect the sensibilities of the patient's families, and we are your superiors. Can you imagine how you will respond to patients and ordinary people who come here? So stop it. What you are doing means there's a problem here. That's when the minister came in to say that, look, my brother, if you are talking to us, your superiors this way, and you will not even take advice that don't use that phrase again, then you can imagine how you will talk to ordinary people who come here and have issues and complain about it. So that is what that altercation is all about.